Hello, in this video I'm going to be talking about preparing for breast cancer surgery, or really any type of surgery. Before I go on, I'd love to invite you to subscribe to our YouTube channel. We put new content out a couple times a week, and if you subscribe, you'll get notified when we have something out that might be of interest to you. Also, I want to remind you that you can go to Yerbba.com to get your personalized report. So what are some things you can do before surgery to prepare yourself? And what about the day of surgery? And then what about afterwards? How can you prepare for the period after your surgery? Well, the most important thing before surgery is to get yourself informed, educate yourself. Learn as much as you can about the procedure that you are going to have. So if you're having a breast-conserving surgery, that's one thing, right? You know the label on the surgery, but you want to find out how long will you be at the hospital? What do you need to do ahead of time? What should you expect when the surgery is over? What will you look like, feel like? What about getting back to your normal activities? What about getting back to work? What should you expect to feel like in other parts of your body? If you go under anesthesia and you're getting general anesthesia, you might want to ask, what will I feel like after anesthesia? There are lots of people on your medical team who want to help you understand what to expect. Don't be afraid to ask questions. Of course, everybody's different, so they can say, in general, this is what people experience. In terms of when you can return to work, I generally recommend taking as long as you can. You're going to be more fatigued than you think, and if you can prepare to go back midweek, so let's say you work Monday to Friday, just for simplicity's sake, try to go back on a Wednesday. That way you're not having a full week, you're going to have a 3-day week, and then get to your weekend. So if you have that kind of flexibility, going back midweek is actually something my patients have taught me is the best thing to do. The next thing to do is to think about immediately after surgery what you're going to need. So you're going to need a ride home from the surgery. Usually places do not let us drive home after we have surgery, even if it's not under general, even if it's done with a nerve block, for example. So we do recommend that you identify maybe even 2 people who would be available. One person can drive you to and another home if people are stretched really thin, but plan that ahead of time, a week or 2 ahead of time if you have that much time. The other thing is when you first get home, you're not going to feel like cleaning the house or getting things all ready for yourself. So do things like get beverages that you like and set up your bedside table so everything is within reach. If there are big things you want to get done before surgery, get help getting them done. So you may have a closet you wanted to empty out for, let's say, years. Don't plan on doing it when you're home from surgery. If this is really important to you and you think you won't be able to relax in your bedroom till it's done, get somebody else, enlist somebody else to help you with a big project. But in general, making sure your bills are paid, making sure you've communicated this with everybody before you go is in your best interest. So you're not coming home thinking, oh, I'll just email people. Again, you might be, but you might not feel like it. Setting yourself up not to have to do these things can be really helpful. What about the day before surgery? So you'll get instructions about when you need to stop eating and drinking. Your medical team, and in particular when you get your preoperative visit, they'll tell you, for example, no drinking or eating after midnight. Unless you have certain medications, don't take any medications, but they'll go through your medications with you. That's a really good thing to think about as you go to your pre-op visit, is let them know every medication you're on, including supplements. You might want to take a look at our video on foods to avoid around breast cancer chemotherapy. Some of them apply to surgery as well, blood thinners, that sort of thing, and supplements you want to avoid. And stopping eating or drinking will help you avoid throwing up after your procedure. There are some procedures that won't be done if you ate that morning. The other thing you'll want to do is prepare yourself mentally. So if you have somebody in your life that you can talk things through, who won't tell you what you want to hear, but will listen to what it is you need, they can be useful. But on your own, what I'd love to invite you to do is have positive images of how everything's going to go, and try to calm yourself down. You might want to listen to a podcast or some music. You might want to distract yourself. Some people find coloring is helpful, or going for a walk, but just imagine everything's going to go smoothly. Know that you're in good hands, that the people taking care of you care about you and will take the absolute best care of you that they can. Then on the day of surgery, wear loose clothing. Don't wear your favorite clothes. Don't dress up. If you wear tights, don't wear tights. Just wear things you can get into and out of really easily. A lot of people wear extremely comfortable clothes. Keep your jewelry at home. You may want to leave, if you wear any rings or bracelets, make sure you take those all off. You don't want them to get lost. And usually we don't want things like that in the operating room. We want things as sterile as possible. The day of your surgery, you'll go through a check-in process. And one thing I'd love to prepare you for is it might feel like it's really long. Like you were supposed to be there, let's say 9 in the morning or even earlier. If you're supposed to be there at 9 in the morning and you're not taken back to the operative area or the pre-op area till 11, don't worry. Everything is going as scheduled. They might do some tests before you have surgery, like a urine test. They're going to take your vitals. They'll go through your medications. They'll make sure you've signed the consent to have surgery. They'll answer any questions you have. So that time between when you check in and when you actually head into surgery may be a couple hours. It may also be super quick. It depends on where you get your care. But even the most efficient places, it's generally over an hour. Everything's going smoothly. They just don't want to rush you, and you'll often meet with the surgeon and the anesthesiologist that day so that they can make sure that you know what's going on and they know what's in your body in terms of meds, medications, and food. They'll ask you things you've been asked before. They may do a pregnancy test if you're able to get pregnant. So all those things are built into that preoperative, right, the day of your procedure. All right, what about after surgery? You've had your surgery, you're home, all your big projects are done, the bills are paid. What should you expect afterwards? How should you take care of yourself? Well, you will definitely get specific instructions from your care team when you leave the operative area, or if you're hospitalized because you've had reconstruction, you'll get detailed instructions. But just so you know, you'll be sent home with instructions on what to take for pain. In general, we do give strong medications to people having reconstruction because that's a major surgery. If you're not sent home with super strong pain medicine, it's because the people who did the operation are experienced and find that you don't need strong medications that are going to make you loopy and bind you up and make it so you can't get out of the house. So you'll go home with evidence-based medications. If these pain medicines are not sufficient for you, call in. Try not to call in at night. Try to call in the morning so that the team, your own team, can get back to you, ask questions, and prescribe the right medications for you. If you wait till night, nothing wrong with it, but it's less likely that you'll get the person who's been involved in your care all along. Make sure that you get rest. You'll want to minimize interruptions. If you're going to take a nap, you'll want to make sure you turn your phone off and put a sign on your door so people aren't knocking on the door or ringing the doorbell. You want to get lots of rest. But you also want to stay limber and you want to stay out of bed as much as you can. So even though your bed might feel like your nest, making sure you get up and sit in a chair several times a day is really important. Otherwise, you can get to the place where when you stand up, your blood pressure drops, and that can feel terrible. So you'll want to make sure you can do as much for yourself as possible. And if you have people in your family who want to wait on you, let them do it, some, but not all the time. You'll want to maintain your independence and stay as strong as you can. You can actually, go up and down stairs if you haven't had reconstruction to keep your muscles strong. And very soon after surgery, your medical team may have told you that you can start to do some exercises. That's really important. You want to stay mobile and limber and not let everything tighten up. Don't forget to seek support. People can come over and chat with you. If you invite them to come over, just let them know how long you'd like them to stay. So let's say somebody drives 2 hours and you want them there for 30 minutes, and then they have to drive 2 hours back, and you're like, how can I ask them to drive all that way for 30 minutes? You know what? The total time they're driving is exactly the same. It's still 2 hours to you and 2 hours home. It doesn't make it longer just because they stay only 30 minutes. I understand why people might not want to do that, but if you're only up for a visitor for 30 minutes, just let them know. Don't feel bad if you say, I need to rest now. You know, they'll find something to do if they need a longer break before turning around and going home again. You can ask people to check in on you. They can text you once a day, and just know that if you're sleeping, you're not going to write back right away. And then the last thing is, make sure you go to your follow-up appointments. You know, even if you have sutures that are buried under the skin and you don't need to have them removed or anything else done, make sure you go back, because the appointments are set at a time where we might see problems. So fluid might accumulate, for example, where the surgery was, and you'll want to go back when your appointments are scheduled. If you happen to leave and an appointment isn't made, you will get a call about when that appointment will be set up, and if in the very unlikely situation you don't, feel free to call the office. The doctors and nurse practitioners and physician assistants, at least one person on the team should see you after your surgery, and then they can also help coordinate what's next in your care. I hope this has been helpful. I know it's been a lot of information. Any questions or comments, drop them below. We get back to you within 1 to 2 weeks. And while we can't provide specific medical advice, we certainly can validate or answer general questions if you have them. You sharing your experience about what helped you before and after surgery helps other people who are watching our videos. And as always, thank you for watching.